So diabetes is a situation in which the blood sugar levels of a patient is high. Now there are primarily two types of diabetes, type 1 diabetes and type 2. In type 1 diabetes, there's complete insulin deficiency. The body's autoimmune system destroys the pancreatic beta cells that produce insulin, and such a patients need to take regular insulin injections. Type 2 diabetes, the body produces insulin but it is not being able to use it properly, which is known as insulin resistance. Such a patient is usually over the age of 30. With poor lifestyle choices, even adolescents are presenting with type 2 diabetes, which is due to insulin resistance. In type 1 diabetes, the symptoms are more severe and patients suddenly present in the emergency. In type 2 diabetes, the symptoms are more insidious in onset, and many times the patient may not have any symptoms. If the blood sugar is constantly high, that is above the level of 200, then the patient can experience certain symptoms, which are excessive urination, excessive thirst, loss of body weight, easy fatigability, delayed healing of wounds, and frequent infections. For type 1 diabetes, which has insulin deficiency, obviously insulin is the treatment for type 1 diabetes. So carbohydrate counting, frequent checking of blood glucose, and frequent insulin injections. In type 2 diabetes, lifestyle modifications, dietary modifications, and exercise, they form the basis of treatment of type 2 diabetes. And after these things, we can begin with oral anti-diabetes medicines, and in certain cases, we also need to start the patient on insulin. Reversal of diabetes is a topic of hot discussion, especially on the social media. There's a lot of hype and there's a lot of false information about reversal of diabetes. Remission of diabetes can be achieved in few of the type 2 diabetes patients. That is, if their HbA1c is not very high, if the duration of diabetes is less, if their body weight is high and they are willing to lose 10 to 20 kgs, these are the cases in which diabetes reversal or diabetes remission can happen, which means the patient doesn't need any oral anti-diabetic agents and still the HbA1c remains less than 6.5%. How we achieve diabetes reversal? That is by profound weight loss and by a low kilocalorie diet. If the patients start gaining weight, then re-reversal is also a possibility. Therefore, it is suggested that such patients continue with regular health checks and continue with their doctor visits.